In his seminal work, The Myth of Mental Illness, Thomas Szasz challenges the very foundations of psychiatry and the concept of mental illness. Published in 1961, the book has since sparked debates about the nature of mental health, the role of psychiatry, and the definition of illness. Szasz's central thesis is provocative. Mental illness, as traditionally understood by psychiatry, does not exist. Instead, what we call mental illness is merely a metaphor for behaviors that society deems undesirable or problematic. His critique not only targets the medical model of mental health, but also questions the authority of psychiatrists and the institution of psychiatry itself. The foundation of Szasz's argument. At the heart of Szasz's argument is the claim that there is no objective, scientific evidence to support the existence of mental illnesses, in the same way that there is evidence for physical illnesses. While conditions like cancer, diabetes, or infections can be objectively diagnosed based on physical evidence and symptoms, mental disorders such as schizophrenia, depression, and anxiety are diagnosed based on subjective criteria. Szasz argues that these conditions are not diseases in the medical sense, but rather complex human experiences shaped by cultural, social, and personal factors. Szasz contends that psychiatrists have falsely categorized certain behaviors and thoughts as medical conditions, thus pathologizing them. For example, if a person acts in ways that deviate from societal norms, whether through emotional distress, erratic behavior, or nonconformity, psychiatrists may label this as a mental illness. However, Szasz asserts these behaviors are better understood as symptoms of human conflict or existential dilemmas, not physical ailments. The social control aspect. One of the most controversial aspects of Szasz's critique is his view of psychiatry as a tool for social control. He argues that the psychiatric profession has historically been used by the state and society to control individuals who defy social norms. By labeling behaviors as illnesses, psychiatrists can justify the coercion of individuals into treatment or institutionalization, stripping them of their autonomy. In this regard, mental illness becomes a label used to explain and control actions that are seen as threatening or deviant. Szasz's views on this issue were shaped by his broader political philosophy, which emphasized individual liberty and autonomy. He was deeply critical of any form of institutionalized authority, whether it be the state, the medical profession, or religion. In his view, psychiatry's role in diagnosing and treating mental illness was not a neutral or benevolent one, but rather one that supported the status quo and reinforced the power of the medical profession over individuals. The critique of psychiatric institutions. Szasz also provides a harsh critique of psychiatric institutions, which he views as places of punishment rather than healing. In his analysis, mental hospitals are not therapeutic environments, but rather coercive institutions that remove the individual from society and strip them of their rights. He argues that psychiatric hospitals are often used to detain people who have not committed any crime, but whose behavior is deemed abnormal or disruptive. This process, he argues, is a form of social control masquerading as medical treatment. Furthermore, Szasz challenges the practice of involuntary commitment, in which individuals are confined to psychiatric hospitals against their will. He views this as a grave violation of individual freedom and autonomy. In Szasz's perspective, if a person's behavior is deemed harmful or problematic, it should be addressed through legal and social mechanisms rather than through psychiatry. In his view, the use of force in psychiatry undermines the fundamental principle of individual liberty and leads to the institutionalization of human suffering. The problem of diagnosis. One of Szasz's most compelling critiques is directed at the diagnostic process in psychiatry. He argues that psychiatric diagnoses are not based on objective criteria, but are instead subjective, relying on the interpretation of symptoms that can vary from one clinician to another. He points out that many psychiatric diagnoses, such as schizophrenia or bipolar disorder, are based on a cluster of behaviors or feelings that could be interpreted in various ways, depending on the cultural context or the clinician's personal perspective. As such, the process of diagnosis becomes a matter of labeling, rather than an objective analysis of a medical condition. For Szasz, this raises fundamental questions about the validity of psychiatric diagnoses. If a mental illness is not a disease in the traditional medical sense, but rather a collection of behaviors or feelings that deviate from the norm, then how can it be classified as an illness at all? Szasz argues that psychiatry's reliance on subjective diagnoses leads to the medicalization of behaviors that are not inherently pathological. In this sense, psychiatry's medical model becomes a tool for labeling individuals as mentally ill, rather than understanding the underlying causes of their distress. The impact on treatment. Szasz's critique of the medicalization of mental illness has important implications for the treatment of individuals diagnosed with mental health conditions. He contends that psychiatric treatments, especially those that rely on medication or institutionalization, are often ineffective and harmful. Rather than addressing the root causes of a person's distress, such treatments simply suppress symptoms or force compliance without offering real solutions. Szasz was particularly critical of the use of psychiatric drugs, which he saw as a form of chemical control. He argued that these drugs were often prescribed without regard for their long-term effects or the broader social and psychological context in which a person's distress arose. By focusing on symptom management rather than addressing the underlying causes of mental health issues, psychiatry, according to Szasz, fails to offer meaningful healing. Moreover, he argued that the medical model of treatment, which views patients as passive recipients of care, undermines individual autonomy. By framing mental illness as a medical problem that requires medical intervention, psychiatry often ignores the role of personal agency and responsibility in the healing process. In Szasz's view, true healing comes from the individual's own efforts to understand and overcome their struggles, not from external interventions imposed by medical professionals. Criticism and receptions. Szasz's ideas have been highly controversial, and his views on mental illness have been widely criticized. Many psychologists, psychiatrists, and mental health professionals have argued that Szasz's rejection of the medical model is overly simplistic and dismissive of the real suffering experienced by individuals with mental health conditions. While it is true that psychiatric diagnoses are often based on subjective criteria, critics argue that this does not mean mental illnesses are not real, or that they should not be treated. Mental health professionals contend that psychiatric treatment, particularly in its more modern forms, can provide significant relief for people with serious mental health issues. Furthermore, many have pointed out that Szasz's argument overlooks the neurological and biochemical factors that contribute to mental health conditions. Advances in neuroscience and psychiatry have provided evidence that conditions such as schizophrenia, depression, and bipolar disorder have biological underpinnings, including genetic factors and imbalances in brain chemicals. Critics argue that by rejecting the medical model, Szasz disregards these scientific developments and the potential for medical treatments to improve the lives of people with mental health issues. However, Szasz's work has also inspired a significant body of thought in the fields of psychiatry, psychology, and philosophy. His ideas have influenced the development of critical psychiatry and the psychiatric survivor movement, which advocates for the rights of individuals diagnosed with mental illnesses and calls for a more humane and individual-centered approach to mental health care. In The Myth of Mental Illness, Thomas Szasz offers a provocative and critical perspective on psychiatry and the concept of mental illness. He challenges the medical model of mental health, arguing that mental illness is not a legitimate medical condition, but a metaphor for social nonconformity or personal distress. His critique of psychiatric institutions, diagnoses, and treatments raises important questions about the role of psychiatry in society and the potential dangers of medicalizing human suffering. While Szasz's views have been the subject of significant criticism, his work continues to influence debates about the nature of mental health, the power of medical institutions, and the rights of individuals diagnosed with mental health conditions. Whether one agrees with his conclusions or not, The Myth of Mental Illness remains an important and thought-provoking text that challenges the way we think about mental health and the medicalization of human behavior.